Marks Memorial Day, a day to honor service members who have sacrificed their lives for our nation. It's a day that can spark lots of emotions for loved ones dealing with grief. Dr. Reena Mehta joins us now with some ways to cope with that grief. Good morning, Dr. Mehta.
Good morning, Meg. Thank you so much for having me, and happy Memorial Day.
Same to you. So first, let's talk about the different stages of grief. I think it's important for people to remember it's okay to grieve. You should grieve.
Exactly. Grief is a very normal process when you're trying to cope with the loss of a loved one. And today on Memorial Day, it's important to think about and grieve and remember with good respect those people that honored and served our nation. And so when we talk about the different stages of grief, like I mentioned, it's a normal process. So if you are someone who is grieving or know someone who is grieving, it's important to recognize these stages. So number one may be denial, not truly believing what has actually happened when you lose someone. Stage two would be anger. You're feeling anger or bitter towards the fact that, you actually did lose a loved one. Stage three is bargaining. Bargaining saying, trying to make sense of what happened. Why did it happen? Stage four includes depression, when you're having a lot of feelings of sadness and loneliness. And then the last stage of grief is acceptance, when you finally accept that you have lost this loved one and you're ready to move on with your life.
Absolutely. And then are there some people that just can't seem to get over the stages? I mean, is there someone that maybe cannot get to that next stage of acceptance, that final stage?
Yeah, so that is called complicated grief. And that happens in about 7% of people who are dealing with grief. And so that becomes, out of the realm of normal where, you just can't accept it. You just can't move on with your life. And so that would be someone who you would want to recognize, to maybe refer them to a mental health counselor or a psychiatrist to better deal with how to cope with this process.
Do you think it's even harder now in this time of COVID? I mean, for so many months, if you had a loved one die of anything, you couldn't necessarily have a funeral. You couldn't get together with your other family and friends to grieve that person. So it was really a challenging time.
Absolutely. This has probably been one of the hardest years as a nation, as a world, to really deal with grief, because so many people have lost loved ones, friends, family members, in a very unpredictable way. It wasn't something that we could have planned for. And so also coping with grief is a big part of it, which has been challenging to do over the last year, because we really recommend spending time with close family and friends. And during a pandemic, that's been difficult. Other ways to cope with grief is actually allowing yourself to feel the grief. It's okay to feel it, be emotional. That's the only way you'll eventually get to acceptance, is to get out of that denial phase. And it's really important to somehow surround yourself with people that you love and people that you trust, because that is the only way to eventually accept the hurt.
Yeah, I mean, I feel like I hear so many people say, I just can't get over this, or I really can't even spend the time thinking about it. But you really have to go through these steps to properly move on.
Exactly. It's very normal. You should always know that going through these stages and steps is very normal. And with time, it does get better. The acceptance does come, but it's very challenging, especially over a pandemic year.
Absolutely. All right, Dr. Reena Mehta, thank you so much for your time. Again, we really appreciate it.
Thank you so much for having me.
Take care.